Welcome to another episode of Keeping It Local with Kim. Today I have the opportunity to interview Michele Kauffman with Biomagnetic Healing with Michele. Welcome, Michele.
Thank you for having me.
Oh, it's going to be a wonderful interview because I have a lot of questions to ask you today.
Oh, good.
For instance, what is biomagnetism?
Biomagnetism is a holistic alternative therapy. It's non-invasive, it's complementary, that uses medium intensity strength magnets to balance the body's pH levels to maintain homeostasis. The simplest explanation of the principle behind it is to think of your body as a swimming pool. When a pool is clean, clear, and healthy, it's because the pH is balanced, it's neutral. If it becomes skewed, whether it goes acidic or too alkaline, you tend to get algae, bacteria, microorganisms. The pool can turn green. You then have to put either chlorine or soda ash in to balance out the pH. That's the same as our bodies. Our body systems, our organs run on different pH levels, and they need to maintain that to stay healthy.
Well, are there any side effects of it?
Not necessarily side effects, but depending on a patient's parasitic load, when parasites die off, when you change the environment, when you're neutralizing the pH levels, you're taking away their environment. They no longer can survive. Parasites put off a toxin, and that toxin can give us a feeling of maybe fluish, achy, fatigue, which we call a healing crisis, not really a side effect. It's just the process of detoxing.
So what exactly is a healing crisis?
For somebody who comes to me and they do have a lot of bacteria, viruses, parasites, within the next few days they could feel like they have the flu, they could become achy, they could have a headache. These symptoms will go away. It's kind of like feeling worse before you feel better, and then your body detoxes everything and it just goes through its normal process.
So will biomagnetism interfere with other treatments or therapies?
Not necessarily. The only treatments that we don't do actively is when somebody is going through active chemotherapy. We tend to wait maybe a year or two to let the chemo take it, it has to detox through the body. We don't really know how long chemo stays in the body. And when you're doing biomagnetism on there, you're actually cleaning the cells. So somebody who has a lot of chemo in their system still, what happens is now that we're cleaning the cells with biomagnetism, the body's actually absorbing, the cells are absorbing more chemo and can make somebody very sick. So you kind of want to stay away from that.
Oh, okay. So interesting. So how many biomagnetism treatments are needed?
That goes on an individual basis, depending on whether it's acute, chronic, how long you've had these illnesses, what stages they are. Everybody, it's an individual basis. And I usually tell my patients, we'll start with one, we do a follow-up in 4 weeks, and then I leave it up to the patient on their symptoms, how they feel, and how we're going to go ahead and proceed with that.
So what actually got you interested in biomagnetic therapy?
I was diagnosed with Lyme disease when I was in my mid to late 40s. I was bit by a tick when I was a child, and that kind of explains later on my health issues through my life that doctors couldn't diagnose. And after spending so much money and so many years of doctors telling me I needed therapy, it was in my head, or it was age related, or chronic fatigue, it was caused from stress. I finally went to a doctor who tested me for Lyme, started me on treatments, but things were temporary. IV infusions, just different supplements, all the process, all the money that I spent going through that. One of my friends had been recently diagnosed with Lyme disease, and she had told me about biomagnetism. She said, I'm not sure that it's working for me. I only went one time, but I think you should give it a try. And I did. My husband had also, because I had reactive Epstein-Barr, which is the monovirus, it causes the monovirus. He was sick for about 4 months with it. And I went for my first treatment, and the practitioner told me, what you have is contagious. And if you have a significant other, we really need to treat him also, because you guys could pass it back and forth. So I brought my husband in 2 days later, and he couldn't stop thanking me for the, taking me. I feel wonderful. I can't believe the energy level I have, and so on. And I didn't get the instant gratification, but I watched him and I thought, well, I've got so much more going on and chronic things. So I went ahead and went back, and I kept going back until my symptoms changed. And from being able to do 15 minutes of cardio would put me into chronic fatigue syndrome, I could now ride 35 miles on a bike with my husband and wake up the next day and feel wonderful. So now I even myself, you maintain a healthy pH in your body so you don't get sick. I go probably every 8 weeks just to maintain.
Sounds good. So how long have you been doing this?
I've been doing it for 3 years.
Oh, wow. So what drives you to do this? What motivates you to do this?
I was an ultrasound tech for 19 years at a hospital, and having patients come in that were having thyroid ultrasounds and telling me their complaints, I felt like I was listening, talking to myself with them saying the doctor doesn't know how to diagnose me, they don't know what's going on with me, I'm fatigued, they're telling me everything's fine, and I thought, I can help other people that are living what I went through with the doctors just being unable to diagnose you with anything. You can use this on your pets. You can use this. I met women and men who had dog rescues that they decided to learn how to do this so that they could take care of their animals. It's really an incredible therapy.
Now that is extremely interesting to
Yes.
me. That is. So what is your most memorable customer experience?
And speaking of animals, so during lockdown, my cat had gotten really sick. She was vomiting for about 48 hours. And at that point, the veterinarians, they're not letting you go in with your animals. And we had taken her, she was very lethargic, and I thought, we've got to get her to the doctor. So we got her to the vet. And of course, during lockdown, they wouldn't let you in with your pets. The tech comes out and takes the cat in, and they said she had a really bad kidney infection. Now knowing that she had that kidney infection, they didn't give her any antibiotics there, but they sent me home with them. Well, I thought, this is crazy. By the time it starts working, she was curled up in a ball. I had her separated from my other two, and I literally put the magnets on her, treated her, because cats and dogs have very close anatomy to humans. So I went ahead and treated her for that, and within an hour, she was sipping off gravy off of a spoon. She was getting up and stretching. By the end of the day, she was perfectly fine. And I really thought we were going to lose her. And it's really funny because when I do treat patients at home, she's very curious. And by the end of the day, she hops up on the table and she wants to be treated. She knows that this made her feel good. So it's actually pretty funny.
That sounds like amazing. Well, thank you for joining us for this episode of Keeping It Local with Kim, and enjoying our interview with Biomagnetic Healing with Michele. So welcome back. There's going to be more interviews coming.